If your child has speech delays and you're kind of freaking out, this is the video for you. Hello, everyone, and welcome to the channel where we endeavor to educate, equip, and encourage anybody raising a child with a special healthcare need or developmental disability. I'm Dr. Noble. Let's get started. In this video, we're going to be talking about the 4 common ways to think about children who present with speech delay. This is by far and away one of the most common referral questions that I receive in the developmental clinic. And I think I speak for my colleagues around the country when I say that the child who does not speak or does not speak well is a very common reason for a referral to a developmental pediatrician. We're in that time of year. We're in the time of year where you are going to picnics and you're seeing family members for family reunions and things like that. And you notice as you compare your child's development to the development of other children in your family, you see some strengths, you see some weaknesses. And this is the time of year when it becomes obvious that there potentially are some concerns. One quick disclaimer, and I know you know this because you're smart people, this is a YouTube video. This is not a doctor's visit, okay? So if you have these concerns, take some information that might be useful from our time together. Go and talk to your regular doctor about this, or put some thoughts in the comments, and we can try and provide some clarity as we move forward with other videos. When you are concerned about speech delays in a child, people in general have a few responses to this situation. First thing that people often experience is fear, anxiety. I mean, it's stressful. You know, speech and language progression in a child is something that most parents really are excited to see occur in their children. They want to hear the first words. They want to hear the response to voice, the request. And when you don't see that natural progression in a timely fashion, it causes people to become anxious or stressed. And so that's a common response. The second response is even further along than just anxiety in the moment. It's looking off into the distant future and imagining a life where your child is unable to live independently or to make the necessary strides. It's tempting to take the off-road or the off-ramp when you're parenting and into the town of doom and gloom, and then just sit there and buy property and just think about all the terrible things that are going to happen and all the great things that will never happen. But I want you to receive today that, you know, speech and language delays, it's tempting to do that, but don't take that off ramp. Those types of strategies and those types of thoughts don't lead you anywhere worth staying. The third response, and there are many, but the third response is often minimizing. Okay. And this might not be you because you're watching this video, but it might be a spouse. It might be a physician. It might be, your primary care provider, could be a family member. And they'll always say the same thing. They always say, Einstein was a late talker. Man, I didn't talk till I was 4. I mean, look at me. I didn't talk till I was 14. And yeah, there are examples of that. That does happen. Those are rare examples. Okay. And I don't think that minimizing speech delay is the appropriate response. Certainly the tincture of time can give us some better insight into what's actually happening with your child. But I don't think that minimizing is the goal. And your experience and how you're experiencing this problem might not be any one of these 3, but know that there are a variety of different ways that people receive a speech delay in children. But what I want you to understand is, from a physician's perspective, from a developmental behavioral perspective, from in my opinion, there are 4 big ways to address and approach a child who's presenting, either your child at your home or child presenting to a developmental clinic with speech delay. There's 4 big ways to think about it. The first way to think about it is to think about it exclusively as a speech language disorder. Now you're thinking, well, isn't that what it is? I mean, the child doesn't speak well, so certainly they have a speech language disorder. And that's not my point. You're correct. But my point is, sometimes it's speech language disorder, period. Sometimes it's speech and language disorder, ... But the first step is to determine whether or not what type of speech language disorder it could potentially be. So let's look at this. I'm going to make this a little bit bigger so you can see this. So when you think about speech and language disorders, as you can guess by the name, they split up into 2 different categories: the speech category and the language category. The speech category can be broken down into a few things. The first of which is articulation. That's the clarity of speech. So maybe your child has a speech delay, but it's not that they're not trying to make words. It's that the words that they're saying are unclear. Right? They're jumbled. So instead of rabbit, you say wabbit. And the key here is if you have a child with an articulation disorder, if they're your child and you hear them say things incorrectly often, you begin to interpret for them and you know what they're saying. Okay. So that's a good example of somebody who has an articulation disorder because they say the wrong thing. They say words the wrong way, the same way all the time. And that allows for an interpreter. So that's an example of an articulation disorder. Speech is also made up of voice abnormalities. So quality of sound, pitch, tone, intonation can also affect the child's ability to produce speech sounds, and then certainly fluency. So by this I mean smoothness. So think about a child who has a stuttering condition. So there are several speech problems that can result in a child with a delay in the emergence of typically patterned speech. Okay. But there's always there's another side to the coin, and that's the language side of it. So this can be broken down into three categories as well. Expressive language. Essentially, what we mean there is, the ability to combine words in a way that leads to meaningful communication. So I see lots of kids and they don't have a speech delay per se, right? What they have is they have several words that they use, but they don't use their words in a way that to meaningfully communicate their needs or their desires within their family home. Receptive language. Now, this is a little bit different. This is the ability of an individual to understand what's being said to them. So if you have a child with an expressive language disorder, they have trouble putting words together in ways to be meaningfully communicative to those around them. If they have a receptive language disorder, well, their delay is in comprehending what it is that's being asked of them. So an example, a 15-month-old child might understand a one-step command with a gesture. Put it down, bring it here, right? As children get older, they might not need the gesture anymore. And then they might even be able to understand a two-step unrelated command as they get over the age of 2 and later. The last aspect of language is pragmatics. And this is the understanding of the unspoken rules, understanding when people shift when they talk to you, maybe they're getting impatient or they look at their watch, or understanding just this idea that I talk and then you talk. So speech and language disorders are complicated, but the thing that I want you to take away from this discussion is that all of these situations have a few things in common, whether or not it's a speech issue or a language issue, and that is an elevated intent to communicate. So what does that mean? That means that this is a speech language disorder, period. In general, there's lots of nuances here, but in general, a child who has a speech problem or a language problem, but has an elevated intent to communicate tells you that you may need to dig deeper and look into a few other issues. But by and large, if they have an elevated intent to communicate, it means they're trying. I'm pointing, I'm signing, I'm dancing, I'm nodding, I'm doing whatever I need to do to help you understand. My issue is a speech and or a language problem, but it's not a desire problem. I'm trying to communicate with you. So what do you do? If you have a child and you've watched this and you think, I think it's primarily a speech language problem only. They have an elevated intent to communicate. I feel like they're really invested in growing in these areas, and it's becoming increasingly frustrated for the child because they're not able to build on those learned skills. You want to send them at that point, or you want to have an evaluation with a speech therapist. Okay, now these are individuals who could be in the schools. These are individuals who are available in your community and typically will bill your private insurance carrier in order to provide those services. Typically, speech therapists in your community will require a referral from your primary care provider. So you're going to want to talk to your regular doctor. Okay. Early intervention referrals is another way to think about this. If your child's under the age of 3, they could be seen by an early intervention team within your state. And those are services that are funded by tax dollars and can be provided to you at no cost, either at home or at daycare. And they also have a speech therapist on their team who can provide a valuable and timely assessment and even put those therapies in place while they prepare your child to transition to preschool. The second reason why children struggle to effectively communicate and are late in their talking is because they don't have adequate hearing to facilitate language. There's two basic kinds of hearing difficulties that can impact a child's language. There's a third, which we'll talk about briefly, but it's an important stop on the journey to understand that we have to take into account a child might not be able to adequately hear. There's two kinds of big hearing difficulties that we'll talk about. One is conductive. Okay. And conductive hearing difficulties basically has to do with the outer ear. Okay. So think about like there's something in the ear, like some wax, or there's even some type of fluid in the inner ear. So like recurrent ear infections can impact a child's ability to hear. So recurrent ear infections, these types of hearing difficulties are often transient. You get an evaluation with an ear, nose, and throat doctor. You put in some tubes, you drain the fluid, you remove the earwax, and then hearing can improve. And then the conductive difficulties can go away. And oftentimes, once you get the hearing from a conductive standpoint rectified, a child's ability to build on learned skills and meaningfully communicate using speech and language dramatically improves. There's another type of hearing difficulty that a child can have, and that's called sensory neural hearing loss. And that is inner ear and auditory nerves. So that's deep, deep, deep. It's on the inside of the ear. So between the ear and the kind of the brain and the wiring in that aspect is where you'll find sensory neural hearing loss. Okay. And that is typically permanent. So that comes from infections that a child may have had as a newborn. It also can be commonly seen in genetic conditions. What do? Audiology evaluation, and know that an audiologic evaluation can happen in many, many ways, but it's something that you do want to talk to your primary doctor about to ensure that you receive a timely evaluation. The earlier you intervene in a child's hearing loss, and that issue is rectified, the quicker they will access the ability to build on learned skills and speak effectively. The third point, when you think about a child who has a speech delay, is whether or not there is the presence of a cognitive impairment. A cognitive impairment. So what I mean by this is think about a child who has a discrepancy between their brain age and their body age. Okay. So think about, so you have a child who's 24 months old in their body, right? So they're running, they're going up and down steps, and they're living their life, but they may be communicating at a 12 to 14-month-old level. Maybe they've got maybe just a handful of words, or they may have a receptive delay where they're not yet understanding a one-step command with a gesture. So that's a child who may be 24 months in their body, but they might be younger in their brain. Think about a child who presents not just with speech and language delays, but with global delays in problem solving, delays in some adaptive and fine motor skills, delays that expand beyond just the ability to effectively communicate. Okay. But again, as I've said earlier, these are individuals that even though they have a delay or a cognitive delay that may be causing language difficulties, these are individuals that have an elevated intent to communicate. They're still trying to communicate. They're still giving it their best. They're still attempting to be a part of the conversation as best they're able. So what do you do in situations where you suspect a cognitive delay? Well, early intervention referrals are still going to be important. It's still something that I think that you should consider, because there'll be a lot of therapies and services they can put in place in the home or daycare. A developmental pediatrics assessment, somebody like me, or potentially a clinical genetics assessment could also be valuable, because there's a lot of therapies and services that need to be put in place. We need to better understand what the strengths and weaknesses are of the child and refer accordingly. And then sometimes, depending on where you live, a psychologic evaluation, receiving a referral or an evaluation with a psychologist in order to undergo cognitive testing or IQ testing to better understand what your child might need. Lastly, the most common concern that most parents have when we think about a child with a delay in the emergence of language and a potential need for further evaluation, most people are going to be concerned to some extent about the possibility of an autism spectrum disorder. Okay, so I want to spend the remaining time we have talking about that. So autism can best be understood. Okay, and this is my medical opinion. Okay, it's my medical opinion. We're going to talk a little bit about diagnostic criteria, but autism can best be understood as a diminished intent to communicate. Okay, the individuals who are present to the clinic, and I have a concern for an autism spectrum disorder, one of the many things that I look for is a diminished intent. I look for a child who doesn't seem interested in communicating with me or helping me understand what it is that they most want. There's several different diagnostic categories beyond the scope of what we're talking about today, but in general, children where there's concern of an autism spectrum disorder have impaired social communication and social interaction. So they have delays in their reciprocity, so their response to their name being called. They have delays in their nonverbal skills, so understanding that, reading the facial gestures of someone else, and knowing that maybe there's a tense moment in the room or that someone is hurt. These individuals also can struggle with their relationships. Again, so the give and take of language, the give and take of play skills with other people, other children, or delays in their play skills. So the way that they use toys, the way that they play with cars or demonstrate imaginary play. There's also restrictive, repetitive behaviors, interests, and activities. This is the second broad category that we think about in regards to an individual with an autism spectrum disorder. And these are things that many of you have heard of or read about, stereotypical and repetitive movements. So hand flapping, spinning, rocking, toe walking would be an example. Inflexibility. So moving from a high preference activity to a low preference activity is difficult for any child, but particularly difficult for individuals who may be on the autism spectrum. Restricted interests. So not a lot of interest outside of a few select items. And those are items and activities that they prefer to participate in for big chunks of time. Okay, for longer chunks of time than you would expect a child at that age. Oftentimes I'll ask families, if you left him or her to their own devices, you gave them the highest of high preference activities, media excluded, okay, because that captures the attention of a lot of children. If you left them to do that, how much time would I expect them to spend doing that? And oftentimes they'll say things like, yeah, I think he or she would stay doing that activity on their own in a separate room all day if I didn't interrupt them. And so that would be an example of the kind of things that I'm looking for in these evaluations. And then lastly, sensory difficulties. You think about kids that have sensory difficulties. So bright lights, loud sounds, textures of clothing, and food discrepancies, things that are just difficult. The gravity is heavier for them than other people. Lights are brighter, sounds are louder. These are things that individuals who are on the spectrum can really struggle with. And then what to do here? Speech and language speech therapy evaluations are also very, very helpful, because we need to instill in children who are on the autism spectrum the importance of learning to effectively communicate your needs, and to help kind of challenge this diminished intent to communicate, so that we can build on those learned skills and make that move towards a more independent communication strategy. Early intervention referrals, as I've said earlier, is also paramount in these types of situations. They can help children access necessary therapies and services in your community, but they can also help you transition to preschool when it's time. And then lastly, a developmental pediatrician, someone like me, could also be very helpful in making sure that care is coordinated appropriately, and that a diagnosis is clarified if necessary. So those are the four big reasons. Okay, those are the four big buckets, and that's a gross overgeneralization. It's a huge overgeneralization, but it's a framework, okay, to help you move from being overwhelmed and stressed out at the family reunion or the picnic to thinking, okay, let's think about this logically. Is it a speech language disorder, period, or is it a speech language disorder, ... Does my child have a diminished intent to communicate, or do they have an elevated intent to communicate? Is it a hearing difficulty, right? Do I need to get my child's hearing tested? Do they startle when I drop a pan? Do they turn when somebody knocks at the door? Do they come in from another room if they hear me open up a bag of chips? If the answer is no, get the hearing tested? Do they have a cognitive impairment? So it's not just speech and language, but maybe there's a more global developmental delay at play that we need to get further assessed. And then lastly, are there concerns for an autism spectrum disorder? If there are things that you wanted me to address in this that I missed, please check for the upload and put it into the comments, and we will do our best to address those things, because this is for you. These videos are for you so that we can support you on your journey to ensuring your child's developmental progress. Okay. If this is useful to you, we will be doing another live at 5 on Tuesday, the 15th of August. And I'll be talking about some of the most common red flags for an autism spectrum disorder. Look, nobody expects us to be perfect parents. Nobody. Okay. You don't always catch the delays. You don't always know what to do with the tantrums. You don't always know where to go or what to look or who to talk to. No one is asking you to be a perfect parent. All we need to do is endeavor to be better. To be better. All we got to do is be better. And what I want you to understand is that the only way that we can really make progress in being better is if we stick together. Thank you for watching these videos. Join us next week. Look for further uploads. Let's stick together. You can do this. Thanks for your time. I appreciate it.